Hello viewer, this is GBS TV Africa and we are on Health Talk Show. I'm your host Lucy Wanza-Kariuki and today we are going to discuss about the respiratory system. Many people do not understand what it takes in to breathe in and to breathe out, to have clean air, to have your air purified. But today we are going to take you through this so that you understand what organs of the body and what makes them perform their functions well. In the house with me is our beautiful guest who is going to introduce himself to take us through the show. Kindly welcome.
Thank you very much, Madam Lucy and GBS for giving us this time to be here to talk to our viewers about the respiratory system and pathologies that may affect the respiratory system. Thank you so much and welcome.
Thank you so much, Omito. Many people breathe in, not many, everybody breathes in and out. Kindly let us know, when we breathe in, when we breathe out, what do we breathe?
Okay, the process of breathing in and out essentially is to take in air, yes. That is oxygen, because the purpose of our lungs is to exchange the oxygen, to take in oxygen into our bodies because the oxygen is needed into our bodies, and to remove the carbon dioxide that is already, that's a byproduct of used things in our bodies.
Yes.
Yes.
So we are taking in
basically
oxygen.
It's the exchange of
gases.
Gases, yes.
Yes. I am sure you're going to tell us where that exchange takes place. But meanwhile, where does it start from? We know there is the nose, which we use to breathe. Is that all? What is nose?
The organ is big. Let me say it starts from the nose and your mouth. It assists us in breathing.
Yes.
Way into your lungs, and the smaller places in your lung where we call the air sacs, where the air exchange takes place. Yes. So maybe can I go into some details about it?
About the nose, so that now we proceed downwards.
The nose is the external part that we see out, physically see. But from the nose, we go to your throat. From your throat, there is an organ there we call larynx. Yes. This larynx is where it produces voice. As air passes through the larynx, it makes us be able to produce different sounds as we talk.
Yes.
It's produced from the larynx. Then from the larynx, we go down into the trachea, which in simple language we call it windpipe.
Windpipe.
Yes. From the windpipe, further down into your lungs, it branches to, we call it bronchi. We have two, the left one and the right. It branches into two. From the trachea, then it branches into two. One goes into your left lung, the other goes into the right lung. On the right lung, we also have three branches of the bronchia into bronchioles. And then on the left lung, we have two branches. Those branches, again, they divide into smaller branches that goes deeper inside your lungs.
In the lungs.
Yes, where we have the air sacs. The lung itself looks like a spongy-like tissue. Spongy-like tissue. And inside there, we have the air sacs. And medically, we call it alveoli.
Yes.
Yeah. So in the alveoli, that's basically where the air exchange takes place. There is also some part of blood circulation, which also follows those small branches into your lung tissues, into your alveoli. Whereas the lungs circulate into your alveoli, they exchange the gases. They take in oxygen and remove the carbon dioxide. And then we breathe out the carbon dioxide and we use the oxygen in our bodies.
Okay, so mainly we have specific organs, and one of them you said is the nose.
Yes.
From there we have what you have described as the larynx.
Yes.
From there we have the windpipe. which has branches go deeper to the lungs, and now the lung tissue itself.
Exactly.
So when we talk of the nose, we see it is what we can see.
Yes.
It is the two holes, the tough tissue here. Why is it so tough? Why is it that it is like that? Sometimes we see people's hair growing there. Yes, and I've seen people try to cut with scissors because they feel irritable. They feel that it is wrong. What do you have to say?
Okay, the nose is made of tough tissue. We call it cartilage.
Cartilage.
It's to make it have the shape so that it stays open.
Yes.
Because if it is as soft as the skin, then it will collapse. So that cartilage, that tough tissue, helps it to stay open so that it allows enough air to go into your
So
into
the
your
toughness
body.
is for the work.
Yes, it helps to shape the noise, to make it be open. Yes, that's God's creation.
Yes.
If it was soft like this skin of ours, then it will definitely collapse, and it will be difficult for you to breathe.
Yeah.
Yes, the hair that you see in the nose it also has a purpose there, and it helps us trap some maybe big particles that maybe will go in with the air. So the hair in the nose there, they help trap those big particles.
Yes.
Maybe an insect or something that maybe will go through your nose. The hair helps trap them.
So the hair should not be cut.
Yes.
Not unless?
Not unless it grows so long that maybe it's protruding outside
somebody.
and irritating. Maybe you can just trim a bit. That is protruding outside. But the inside there, let it be there. It helps.
Under normal circumstances like now, what should the nose produce?
Above the nose, we have some, there's an air space somewhere. We call it sinus. In the sinus, there is just like an air pocket. The air pocket there helps us warm the air and moisten the air that you are taking in, so that is not that dry. And there are also some glands at the base of the nose. These glands helps us to produce the mucus. This mucus, maybe the dust, the hair is dusty. So those mucus help trap those dusty things or small particles,
which have bypassed the
air
now.
The hair. So it helps trap them so that they don't go into the deeper parts of the lungs.
Okay.
Yes.
Are there people without nose?
That we can
Biological,
say,
not accidental.
Yeah, it can happen because of the congenital malformations. Yeah, maybe something happened during the process of, we call it the formation of the fetus in the
womb.
And maybe there was that malformation that somebody comes maybe without the nose is not well formed.
Well formed.
Or, yeah.
Yeah. They call them tubal neurodefects.
Yes,
the
exactly.
tubing was not well done.
That is not so common with the nose.
Yeah.
Though there's this abnormality of the buccal and the nose. We call it, this word is a lot, I'll tell you.
Okay. So it's an abnormality to be
Yes.
born without a nose.
Yes.
I'm sure
left
we
palate.
Yeah,
left palate, where the nose and the mouth buccal is just a hollow. Yeah.
So from the nose, you said we go to larynx.
Yes.
To the common person, our viewers, who has never heard of that, or maybe in your biology, and not everybody takes biology.
Yes.
You've never heard of the larynx. What is this we are calling larynx? Does it have a function? Do we all have it?
Yeah, we all have the larynx, as I've said, just below, somewhere at the level of your throat here. There's this hard tissue here, just around that area is where we have the larynx. The larynx itself is like, in another term we call them voice cords. It's
Chord.
like, yes.
Yes.
It's like, let me say, strings that is placed there. So as when air passes through, that vibration of the strings, and as you control the air passing through it, is what helps us to produce different sounds. Yes. That's why it is called, in a simple term, voice cords. Voice cord, yes.
Is there a difference between voice cord and voice box?
The voice cord is string-like, and the voice box is the whole system of the larynx. Yeah.
What is its function? What does it do?
The main function is to help us produce different sounds. Yes.
We sing, we laugh.
We sing, we laugh, we talk, that function.
Yes.
That's exactly for the
Are there
larynx.
people without it?
Again, for that one, maybe for the congenital malformations, but mostly we all have larynx, unless for the congenital malformation that maybe will make somebody not talk or something else happens, yes.
From the voice box now, we are going to the voice cords and the voice box.
Yes.
I'm sure there are times when they are also affected. But for now, we go to windpipe.
The windpipe.
The
yes.
windpipe. You said it's also called trachea.
The trachea.
Yes. Yeah.
The trachea, again, is made of cartilage tissue. If you remove it from the body, it will look something like plastic. Rings, plastic rings arranged.
Yes.
Yeah. So that cartilage and that firmness of that trachea also helps to keep it open. To keep it open to allow enough air into your lungs. Yes, it's basically that cartilage tissue, ring-like, arranged in several layers that helps the air to pass through into your lungs from the nose and from the mouth. Yeah. So
does it have the protective, I don't know what to call them, but like the way we have the hair in the nose, what does the trachea have to make it perform its function? You said one of them is the cartilage to keep it open.
It's a cartilage tissue.
Yes, now already it is open.
Yeah,
it is stable. It's not
enough.
collapsing.
Yes.
Yes. What else does it have?
Okay. On the trachea, we also have some tiny air,
cells.
air-like things on the trachea. So this tiny hair-like in the trachea, it also helps again in trapping some other smaller particles that have gone through the nose, through the larynx, and it is now reaching your trachea. So those the hairy or whatever in the trachea helps trap some of them, and then they produce a lot of mucus. Those hairy, like we call them cilia, medically, cilia reaction. So the cilia reaction, sometimes they help propel any foreign things that goes into your lungs. They propel it backwards, upwards.
Backwards,
yes,
not downwards.
Not downwards. So they help push them towards outside instead of going inside your lungs. So that cilia helps in removing any foreign particles, like maybe dust has entered, pollen, or anything. And it produces also a lot of mucus that helps also trap those things and try to wash them out. Yes.
So what you're trying to say is that nothing can ever pass through the trachea. Can we say so?
Yes, we can say the way it is designed, anything rather than air should not go inside your trachea. And that's why maybe even if you are swallowing your saliva and it goes on the side of the trachea,
Yes.
then you will cough a lot to expel it, to expel it outside, to remove that whatever is going there that is not supposed to go.
So what you're trying to say is that there is a communication between us when we are eating and when we are breathing.
Yes.
But there is something that keeps the trachea on track.
Yes.
You are going to tell us that thing after the break. Viewer, you're watching GBS TV Africa. This is Health Talk Show. We're discussing about respiratory system. Thank you, viewer. We are continuing with the respiratory system. It's such a wonderful topic. I know we all breathe. We use the nose, sometimes we use the mouth. And our guest was discussing about breathing using the nose. Now we are going to talk about breathing using the mouth. Is it ethical? Is it right? And what are some of the reasons which will make you or I to breathe using the mouth? Welcome.
Thank you so much, and welcome back, our viewers. Okay, as you just mentioned, the main organ for the breathing is the nose. But sometimes, because of some issues on your nose, maybe you have some flu, you have something affecting your nose, and your nose maybe it is blocked, and you cannot take air properly. So you find yourself breathing through your mouth.
Yes.
So it will keep you need to keep your mouth open so that air goes in and out. But basically, as we breathe normally without any issue, we should be breathing through our nose. Unless those other issues that are there that can make you now
those abnormal
reasons.
Yes.
That will make you to breathe now with your mouth. So it will assist. It assists us also to breathe.
Yes.
Yes. So, yeah.
How is mouth adapted for breathing? Because if there are some reasons which will force you and I to breathe using the mouth, how is it?
Yes. As I've said, for some reasons, if your nose is blocked, you'll find yourself breathing through the mouth, and you'll need to keep your mouth open. That is, your lips will stay open so that you are able to take in air through your nose into your buccal cavity, and then they connect with the nose down there at the level of your throat, where we call pharynx. Yes, the nose and the mouth connects there, and then it goes into the windpipe.
So it's an uncomfortable way of breathing.
It's an uncomfortable way of breathing.
Yes.
Yes.
Where does the two, breathing through the mouth, when you breathe through the mouth, can you breathe at the same time with the nose, or you have to use one? You
can also breathe the same time. You can breathe the same time because they are all open, and
yes,
when you are taking in air, you can go through both through your nose and mouth.
Okay, because, yes. Now when we talk of the mouth and the nose, they meet somewhere. And as you have tried to explain, is that yes, you cannot be able to allow, the body itself has a mechanism which does not allow anything to pass through the trachea, which yes, is the windpipe.
Yes.
But now here comes the mouth, we use it for eating.
Yes.
And again, we have said we can breathe through the mouth. So when you're eating, when you're drinking something, where does it go? Why does it choose not to go to the trachea and go to somewhere else?
Thank you.
Yes.
That's a good question for our viewers to understand. There is a mechanism of closing and opening of the trachea.
Yes.
just at the entrance, there's some, medical we call it sphincters, some kind of muscles, that when you want to swallow something, that muscle closes the trachea.
Yes.
So it closes this side that you are supposed, air is supposed to go when you are trying to swallow something.
Yes.
So it closes the trachea so that food goes into the, we call it the esophagus. Yes. Yeah.
What
So,
do we call it?
Yeah, that muscle, okay, generally we call them sphincters.
Yes.
Yes.
So what is that organ which closes the airway, the airway, and opens the food way? We said that we are eating, we are drinking.
Yes.
So that those are foods and beverages.
Yes.
They will find themselves somewhere and also the same way to the air. So what is this which closes the two?
Yeah, that's what we call the sphincter. It is a muscle kind of. When you swallow, it closes the airway tight, and also the position of the airway, the way it is placed.
Yes.
From the mouth, it is direct to the, it goes directly to the your esophagus.
Yes.
That's where food passes into your stomach. So when this muscle closes and the way the nini is placed, it allows food from your mouth directly to drop into your esophagus, and it closes this other way that the air is supposed to go, so that no food goes into there. So that's why sometimes when you are talking and maybe with a lot of food in your mouth, you can easily be choked because you'll try to open the airway.
And you're opening the food way, the esophagus.
You're having something in your mouth, then it goes into the wrong way, and then it causes you to choke.
Yes.
Yes.
So that is why even our primary school teachers, that is where we first learned the first table manners, that don't eat and talk at the same time.
Yes.
It is a good table manners, not only for just character, but for safety of our health.
Yes, yes.
So you've talked of choking when you're eating. This means now you cannot choke the esophagus. You can choke the airway.
The airway.
Meaning
exactly.
that the food, when we talk of choking, we are talking about the airway.
Yes, yes.
Because recently we had a discussion on choking, and it was wonderful, whereby after that now you can be helped to cough the food out.
Yes. Yes.
So last time when you were in this house, you talked of cough as a normal process for breathing. Now here we are again. We are talking about the airway. There is something else which we can call sister to cough, which is sneezing.
Yes.
Can you kindly talk to us about the two now in terms of protection of the airway?
Okay, coughing and sneezing. Okay, for coughing, you can even voluntarily cause the coughing. When you feel maybe
I can choose to cough.
You can choose to cough.
Yes.
Maybe you just want to voluntarily clear your airway, so you can just cough. Or sometimes it just comes automatically when something strange goes into your airway. Then you cough to remove it. That coughing reflex just comes automatically. That's the way our bodies is designed. And maybe I can say that there's no that big difference with the sneezing. Though sneezing comes with a lot of pressure. It forces you to use a lot of force you are to remove whatever is blocking your airway. So sneezing comes with a lot of pressure and force. Yes.
Can we say in a layman's language that sneezing, it protects the outer airway, that is the nose, and cough is for the inner?
The inner part.
Yeah,
we can say that. Yeah.
Yeah, because you know, anyone who has ever sneezed, the outer one is usually very affected, and you find that You even see whatever was irritating you to sneeze. But
Yeah,
sometimes for a cough, you may not see
Yeah.
what was irritating you, because by good chance, the food pipe opens, it goes in, and the problem is solved.
So as I was explaining, you know, with sneezing, you even use more muscles.
Yes.
Your chest muscles, your ribs, your diaphragm to push with a lot of force.
Yes.
That's why you open it with a lot of force, yes.
Now you've talked of the trachea.
Exactly.
The windpipe.
Yeah.
Its size. Is it something that is big? Like, as we grow, yes, we know children grow, and we know during the old age, they wear out. But generally, is it something that that is, the circumference is big, or is it something that is very small for a normal adult man?
It's not that very big. Maybe I can say it's a pipe of like 1 inch pipe.
1 inch.
If I can try to
The
estimate
diameter.
this. Yes. If I can try to estimate that. Yeah.
Which means it's not something small.
It
Maybe
is big.
later you will be telling us the amount of air that we can breathe in one cycle, so as to understand why it is that size. Because even the nose, it's not very small, considering you have 2 nostrils,
Yes.
not one, which take in a lot of air at the same time. So from trachea, now I'm sure we are going somewhere. You talked of the 2 branches,
Yes.
which go into each lung.
Yes.
Do they perform the same function with the trachea, or they are different functions?
It's just basically the same function. It's now going to, because both lungs have to be supplied with the air equally. So that's why we have the right branch and the left branch. Just from the trachea, it branches into 2, where we call it the bronchi. So there's a left bronchi and the right bronchi.
Yeah.
So the left one supplies the left side of the lungs, and the right one supplies the right side of the lungs.
Yes.
Yes.
So now the small branches from
But
trachea,
it's a bit smaller compared to the trachea now.
trachea.
Yeah.
So you said from trachea, we go branching until now we are in the lung surface.
Yes.
And you talked of the air sacs inside.
Exactly.
Remember when you were beginning, you told us that there is an exchange of gases, whereby the oxygen that the nose took in passes through the trachea and to all these branches. Is not the air that will come out. So what happens, and at what particular point does this happen?
So on the air sacs, what we medically call the alveoli,
Yes.
that's exactly where that exchange of air takes place. There is the branch of blood supply that comes into your lungs. Then from the supply, that gases that is inside the blood and the lungs, they get exchanged, where you remove out the carbon dioxide and the other gases that is not needed into the body, and you take in the oxygen into the oxygen goes into your blood. Yes. So the blood will be going back to the heart full of oxygen. Yes.
So what you're
the one which is coming, the blood that is coming into the lungs is full of these other gases that the body does
that
not
are not
need.
needed.
Yes. And from the lungs, those gases, they exchange mainly oxygen and carbon dioxide, where the carbon dioxide is removed from the blood, and oxygen is pumped into the blood, where there's that. I don't want to go into so much details about the hemoglobin and how it bounds to the oxygen and transport it back to the heart, where it is supplied now to the whole system of the body. Yes.
But I think it is important so that we also understand that this is not a one-stop thing.
Yes,
it is something that is going on. It is a process. Whereby now you've talked of gaseous exchange. These gases are carried by the lungs. But now here we have the blood, which is passing. But they are not like the blood system and the respiratory system are not mixing. But because gases are things that we cannot touch, they are not touchable. What they will do, they will just, there is a process they will take to just, when the blood is passing, the blood will not come to a stop.
The way the alveoli is designed, there are very thin layers that as the blood passes very near to the surface, those membranes allow for the gases to diffuse. The oxygen diffuses into the blood, and the carbon dioxide diffuses outside the blood. Now, if we go to that, that's again a topic on its own. When you start talking about the diffusion and following the gradient, where there is more, where there is less, to allow the exchange of gases at the level of the alveoli.
Yes.
But at least for our viewers to understand, there's that process of gases exchange, which takes place inside your lung at that, we call it, with simple language, the air sacs. Yes.
In short, what we are supposed to understand is that there is an exchange.
Yes.
That at that particular point, as those air sacs come very close to the blood, carbon dioxide will come out.
Yes.
And the blood, as it circulates, it picks the oxygen, which is used for other functions in the body.
Yes, exactly.
So knowing that is very important so that people understand. Now, Omito, we are in COVID era.
Yes.
Just previously, we all were wearing masks, and we had to breathe. Can we say that during that time, our bodies did not get enough oxygen? Or how can you comment about masks and breathing? We know there are doctors who are always in theater. We know there are people who are working in companies whereby they have to use the masks. Do they have impaired breathing?
They don't have any impaired breathing.
Yes.
The mask, as you see, it is a physical barrier.
Yes.
It's a physical barrier that helps us to filter the air that goes into our nose and into our mouth.
Yes.
That's why we put it, and it's supposed to hold your nose and your mouth tightly, so that any air you are breathing should pass through the mask, so that it filters those foreign particles in the air, so that the air you are taking in is clean, is oxygen, and it filters those other foreign particles like the bacteria and the viruses, depending on which type of mask you are using. Of course, there are different types of masks, but it's basically to filter that air that will be going in. But it's allow oxygen to pass in and to filter those other particles that you don't want. They remain at the surface of the mask.
I've heard people say this, Mr. Omito, that I suffocate when I use the mask. Do they lie?
I think it's because they have not been used to wearing those masks.
Yes.
So to breathe through that mask, they find it somehow a bit hard for them, because they feel like they're taking less air, but it's not true. They're taking enough air. It's something that when you get used to it, then you just be comfortable with it. It's because of that just being something you've not been used to wearing every time. So you feel when you are wearing it, it's like, I am choking, but not really choking.
Yes.
Yeah.
Apart from carbon dioxide, are there other gases which come out with carbon dioxide during breathing?
Yeah, there can be other smaller amounts of gases. As we know, the air is a mixture of so many gases. Yeah, there are some other gases, maybe nitrogen and other small amounts of gases in the air. Yeah.
There are people living in mountains,
Yes.
others living in the valleys, others in an enclosed place like we are.
Yes.
Does the amount of oxygen differ from where we are?
Yes. The amount of oxygen differs because of pressure.
Pressure.
Yes. The pressure affects the amount of oxygen that we have. As you go higher and higher, the pressure decreases.
Decreases.
And when you go lower, the pressure increases. Yes. So at lower levels, you find that that exchange is easier. But when you go higher and higher, like you are climbing mountains, then you'll find breathing up there will be a bit difficult because of the pressure. Yes. Pressure, gas, the air pressure there decreases as you go higher. Yeah.
Thank you so much for that. I'm sure the discussion is going on well. Viewer, this is BSTV Africa. Let's continue after the break. Viewer, we are continuing our discussion and we are about to come to the end of the show, but we are going to look at two more things before we complete the discussion on respiratory system. We've traveled away from the nose to the airway and to the lungs. Now we already have gases which have been exchanged. We are now breathing pure air, but there are other things that we need to look at. There is what we call the diaphragm and the ribs. Sometimes when you look at someone who is breathing in and out, you see the movement of the chest. Mr. Ometo,
Yes.
take us through the ribs and the diaphragm.
Thank you so much. Yes, as we're talking about the lungs, there's a lot other things that works together with the lungs. First of all, where the lungs is placed, we have the protection because as we said, the lungs are a soft tissue.
Yes.
And a spongy-like. So it is placed inside your ribs. So the ribs protect it and it covers it around.
Yes.
So there are these supportive structures, the ribs. And again, just below the lungs, we have the diaphragm. The diaphragm is just like a membrane, a flat membrane.
Shit.
Yes, just below the lungs. So these structures all work together with the lungs to help us breathe in and out.
Yes.
How the movement of these structures, the ribs, the muscles on the ribs, the diaphragm, plus the lungs. Yes. So they all work together to support our breathing.
Yes.
Yes. Maybe to go a little bit deeper. As I said, for us to breathe, we have this air, which has got, as I was talking about pressure just before we went to the break. I was talking about pressure. We have the atmospheric pressure. That is the normal pressure of the air outside here. And there is some balance between inside your body and outside your body of that atmospheric pressure. So for you to be able to breathe, these structures, the ribs and the diaphragm, they create kind of a vacuum as they, when your diaphragm, let me say when you are breathing in, your diaphragm flattens and your ribs expands.
Yes.
It creates kind of a vacuum inside.
An empty space.
An empty space inside. Yes. So it creates a little imbalance so that air pushes the atmospheric pressure, pushes air inside into your lungs.
Yes.
Yes. So that entails the process of breathing in or inhaling.
Yes.
Medical, we call it inhaling
Inhaling.
air into your lungs. Yeah. So with that system, and then when the reverse happens, you breathe out. Yes. The diaphragm pushes the lungs upwards, and the chest wall a little bit collapse downwards, so that you push air outside. So that process keeps repeating.
Itself.
That's how we breathe in, out, out. And it's a continuous process.
Okay, that
Yes.
looks wonderful. And how many times are we supposed to breathe in and out normally? And when do we say now this is not normal?
Yes, the process of breathing in and out, we can say it will depend with your age. But for a normal adult without any conditions, underlying conditions, you are just okay. Then around 18 circles, 18 to around 24 cycles per minute. Yes.
So how do you count? Because most of the time you hear we have 24, 16 children, I don't know, 30, 32. How do you count, like, which is one cycle? As a clinician, the patient is here, and if you tell me that I want to count your breathing, I will start breathing well now so that you count well. How do you do it so that you do not create anxiety in me?
Yeah, that's a good question. As we count the breathing in, one cycle is breathing in and out. You will see the chest as it moves. As you breathe in and out, your chest expands and contracts. Expands, contract. So that process of in and out, that's one cycle.
Yes.
Yes. But as when you are counting, you don't need to tell the patient that you are actually counting.
Yes, because we
You'll
will
just be
breathe
looking
well.
at the patient while you have your timer,
Yes.
like a watch or something. You time. Maybe you can be taking pressure, you can be taking pulse, or you can be doing something else, maybe oxygen concentration.
Okay.
When you put that object, so the patient will just be knowing that you are maybe taking the oxygen concentration. But as you are waiting, you can also count the breathing.
Yes.
Yes, you
Okay.
count the breathing. Because if you tell the patient, I'm counting your breathing, he can change the breathing and start maybe panting and
Yes.
breathe more fast
And
and faster
interfere
because
with
of
your
anxiety.
normal rate.
Yes,
Yes.
because of anxiety.
Divers and mountain climbers.
Yes.
Do they have any special adjustments with their bodies that we do not have, or don't dive and or don't go to mountains, so that the normal breathing is not affected?
Yes, I can't say it is a special adaptation, but it's more of a, they train.
They train. It's a skill.
Like, it's a skill, something you do more and more, and then you get that, you get used to it, like holding your hair. Like say for the diver, you can find somebody who can hold his air even for a minute or so, just holding the air. So when you do it more and more frequent, your body gets used to it.
Yes.
So you can find somebody diving there underwater for almost a minute, underwater there. Yes, but it is more of the training.
Okay.
Yes.
So we cannot just, that is this why many people try to swim and drown if they are not used?
If they are not used to swimming. Okay,
Because they are not trained.
First of all, you must know, for you to dive, you must know how to swim. So that's why I'm saying it's more of something
It's a
that you
skill.
can learn.
Yes.
Yeah, it's a skill that you can learn. And the more frequent you do it, the more you're getting used to it, and the more like you can hold your air for a longer time.
Thank you so much, Mr. Omito. It was a pleasure having you in this show. Kindly face your camera, remind the viewer your name, and give your parting shot.
Thank you very much, our viewers, for listening to us. As I said, I'm Martin Omito. I'm a clinical officer. Yes. I can tell our viewers that let us live a healthy life. Let us know our bodies well, and let's live a healthy lives. Yes.
Thank you so much. Viewer, this is GPS TV Africa. We are taking through you respiratory system, and I'm sure you've learned something. Keep breathing, and in case of any abnormality, go to see the clinician. I was your host, Lucy Wanza Kariuki. Till next time, bye-bye.